Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Brad Ray, PA of Topeka, about sprains versus strains. And Brad, we hear these terms commonly. What exactly is the difference between the two?
Well, there is a difference, and a sprain is actually an injury to a ligament. Ligaments are what attach bones to one another, and when there's been an abnormal stress applied to a joint in particular, the ligament can be injured, and that's what we call a sprain. A strain, on the other hand, is an injury to either muscle or tendon, and the tendons are what attach the muscle to the bone to allow us to move joints. And so, depending on where the injury has occurred, it's either a sprain or a strain.
Okay, and how do you know which one you've got generally?
That's difficult. Generally, an injury has occurred, of course, and a person will notice pain. They may notice loss of function, they may notice swelling or even bruising. But it's very difficult to determine, exactly what you have unless you've been evaluated by your healthcare provider. The good news is that most people can recover from these types of injuries if they're of a minor variety, whereas the more significant injuries that have occurred may require significant treatment.
And what are the treatments available?
Certainly, a person on their own should use those principles of first aid by resting the extremity that may be injured, using ice for 20 minutes a couple times a day. Compression can be used if it's an ankle or a hand or wrist, an ACE bandage or compression device, and then elevating the extremity above the person's heart level if they can for several times a day will help with swelling.
Okay, all right, good information. Thank you for being here today.
Welcome.
Please join us next week for a new health topic discussion on House Calls.